Hello, guys. Good day. It's Miss Merle once again, and we will be talking about vitamins. So, what are vitamins? So, they're organic compounds, and they are essential for various physiological functions in the body. They play crucial roles in metabolism, immune function, cell and tissue health, maintenance of overall well-being, guys. So, vitamins are categorized into we have two main categories: the fat soluble vitamins A, D, E, and K, so ADEC. They can be stored in the body's fatty tissues and water soluble vitamins. So we have the water soluble vitamins, the B complex vitamins, and vitamin C that need to be consumed regularly as they are not stored in the body. The water soluble vitamins. So, a balanced diet rich in fruits, veggies, whole grains, and proteins typically provides sufficient vitamins. But we have hypovitaminosis or deficiencies that can happen, leading to various health issues. So, that's why supplements are also available for those who may not get enough vitamins from their diet. So, next is let's talk about the function sources and deficiencies. So, vitamins function as cofactors in enzymatic reactions. They accentuate catalytic activity. And sources, they are obtained from food and in some cases bacterial synthesis. So this is quite a remarkable vitamin coming from bacterial synthesis. We will learn about it later. We also have the thing deficiency on vitamins. So hypovitaminosis, it happens when the dietary intake of a person or the person's absorption is inadequate. So going back to history, in the past, vitamin C deficiency is known as scurvy because in the past, sailors consumed lime to counteract scurvy. And during the early industrial age, vitamin deficiency is very common and it's known as rickets. And for those who are alcoholics, they are affected with this deficiency of thiamine known as beriberi. And niacin deficiency or vitamin A deficiency can lead to night blindness, and that's known as pellagra. And we also have folic acid deficiency, and it is associated with that of megaloblastic anemia and spina bifida. And then pernicious anemia, we have vitamin B12 deficiency, and it involves neuropathies. So insufficiency versus dependency. So insufficient meaning there is inadequate supply affecting metabolism, while dependency is higher than normal demand for proper physiological function is required by an individual. And then investigating dietary vitamin deficiency, the hypovitaminosis. So causes always it will point out to in the inadequacy of the intake of, or there is a problem comes to absorption due to dietary sources and practices. So, hence, under the United States nutritional guidelines, they recommended daily allowances were revised in the 1990s to include chronic disease prevention. So, it included these categories: EAR, AI, and UL, estimated average requirement, adequate intake, tolerable upper intake level. So, what are the following methods for assessing the vitamin status of a patient? So, measuring the following active cofactors or precursors in biological body fluids or in the blood, urinary vitamin metabolites, so we're looking the presence of metabolites in urine samples. We can also measure enzymatic activities since biochemical functions require the vitamins. And then urinary vitamin or metabolite excretion after a test dose. So a patient will be allowed to take something, and then later the metabolite. Somehow it's correlated with number two. And then metabolites of substances requiring the vitamin for metabolism. So challenges in diagnosis. So low serum vitamin levels don't always show functional deficiency. So we cannot really readily correlate with that. Normal serum levels may not ensure adequate function, and proper interpretation requires biochemical and physiological knowledge of vitamins. So let's start with the fat soluble vitamins with vitamin A. So found as retinol, retinoic acid, and retinyl esters from animal products, and we also have from the carrots. So we have the carotenoids, mainly beta carotene from pigmented fruits and vegetables, but not only in carrots, guys, but all those pigmented fruits and veggies. Stored in the liver, and vitamin A is transported in the blood complex together with retinol binding protein and transferrin. So functions, if we can hear vitamin A, we will always think of vision. So retinol is converted to retinal forming rhodopsin for dim light vision. And then cellular differentiation, growth, reproduction, and immunities. Aside from vision, it regulates cell proliferation via nuclear receptors. So it functions in tandem with vitamin D, so A and D for cellular proliferation. And then the most common deficiency, no, no, the most common disease associated with vitamin A deficiency is nyctalopia. Nyctalopia, nic is night, and lopia. So night blindness. So progressing to total blindness if untreated. And there's also epithelial cell keratinization, and it's we can see a deficiency massively in kids, in children, especially in poor countries, in non-industrialized countries due to poor diet. And this one can result from chronic fat malabsorption, liver diseases, severe stress, take note, or protein malnutrition. Sorry. And premature infants, um, it's common in them that we can observe low retinol and RBP levels requirement. That's really the protocol to supplement vitamin A to premature infants because they have low retinol and RBP. And next is toxicity or excessive of, see, the dose makes the poison. So if there's too much of a vitamin, still we can observe hypervitaminosis. So caused by high doses of supplements, liver or fish oils. So it's not also a good thing to always eat chicken liver, guys. Can lead to liver because it can lead to liver damage, and carotenoids are not toxic due to limited absorption and conversion. But that's the good thing, since there's it's not readily absorbed or converted. Then, but you can observe you're having hypervitaminosis with vitamin A if your palms and your the clear of your eyes tend to become yellow. You're not having jaundice, but it's just an excess of vitamin A. So, retinal measurement by HPLC is the standard, and toxicity is done by the measurements of retinal ester levels in the serum, still under HPLC. So, vitamin E, done with vitamin A, now E. This one is really a very powerful antioxidant, and it protects the lipids from peroxidation, especially the unsaturated lipids, and also it has protective effects to the RBC membranes from oxidative stress, and strengthens cell membranes. It supports drug metabolism, heme biosynthesis, and neuromuscular function. So it's a good thing to have vitamin E supplements. Generic name is vitamin E is known as tocopherol, so it includes the biologically active isomers. We also have alpha tocopherol. This is the predominant and most common isomer of vitamin E, and 40% of ingested tocopherol is absorbed by dietary fat and transported via CM or chylomicrons, the VLDL, and chylomicron remnants. I hope you still remember these in our previous lectures. And stored in the liver and lipid rich tissues, and excretion is in the feces. Sources, we have vegetable oils, leafy vegetables, egg yolk, legumes, peanuts, and margarine, and deficiency risk in diets low in vegetable oils, fresh greens, and unsaturated fats. So, deficiency effects will always represent as hemolytic anemia. This is the major problem without vitamin E. Hemolysis, premature newborns supplemented to stabilize RBCs and prevent hemolysis. So A and E newborns must be supplemented and may prevent retrolental fibroplasia, intraventricular hemorrhage, and mortality in preterm infants, and fat malabsorption, and chronic cholestasis in infants or children is linked to neurologic dysfunction in the absence of vitamin E, guys. And this one measured as alpha tocopherol via HPLC. So it's really the mainstream testing or assessment for vitamins is through liquid chromatography, and then indicated in newborns, patients with fat malabsorption, and with those on synthetic diets. And remember, this one works better synergistically with vitamin C, so A and C. So this is also needed for us to maintain normal vitamin A levels. So adult males and females should maintain this one daily. And then toxicity and supplementation. There is no proven health benefit from high doses. So I really don't understand why some people will they intentionally overdose themselves with vitamins, and then no toxic effects from megadose. But the good thing, it's not toxic. See, but in infants, preterm infants, it can increase sepsis and necrotizing enterocolitis. So we're done with A and E. Now let's have vitamin D. Vitamin D. So vitamin D is really needed for the formation, development of the bones, skeleton formation, and mineral homeostasis. And it's produced in our skin, and we cannot produce it without UV light exposure. So there are some uh, religions in which their women are particularly at risk of developing vitamin D deficiencies. But no, I'm not racist, but this is from a book, guys. So Muslim women, especially in Arab countries, they they are really following the clothing protocol. So they are not exposed to sunlight. So it's a good thing, guys, if once in a while you're exposed to sunlight, so that your skin can make vitamin D for you. So once there's this UV light exposure, the 7 dehydrocholesterol will be converted to cholecalciferol, and that's vitamin D3. So another form of vitamin D is ergocalciferol, because aside from having vitamin D from sunlight exposure, UV light exposure, we can also get vitamin D from our diet in the food through food intake. So we have vitamin D2 from the food and vitamin D3 from the sun. That's ergocalciferol, and the cholecalciferol vitamin B3 is from the UV light exposure. And then we also have calcitriol, and this is the most active form. So this active form stimulates calcium and phosphate absorption for bone growth and metabolism. It works with the pH or the parathyroid hormone to move calcium and phosphate from bones. And then it has, sorry guys, pro-apoptotic effects through vitamin D receptor binding, leading to drug development. So guys, remember this one, especially if, for example, you'll be migrating to the States, so you should be exposed to what? The sun. You should have UV exposure 2 hours per day to prevent the deficiency of vitamin D. And then aside from the UV light, also please from your food intake, you should have the following, so that you can absorb vitamin D from your diet. And then RDA, recommended daily allowance is 5 to 15 UG per day, and absorption largely happens in the small intestines, and it needs the presence of bile salts for it to be absorbed. It's stored in the liver, and excretion is in the bile. And then, guys, the deficiency of vitamin D varies if from when it comes to the a particular age group. For kids, it's known as rickets, and while for adults, it's osteomalacia. So failure to calcify cartilage at growth plates, that's rickets, and under mineralized bone matrix. So the bone is like brittle and fragile. That's osteomalacia. So low levels associated with if the patient is taking anticonvulsants, patient is affected with small bowel diseases, with renal failure, especially if it's chronic in a chronic manner, and with hepatobiliary diseases. So, toxic in children because it can cause hypercalcemia and hypercalciuria. So, it can also be seen in the blood and in the urine. So, leading to the deposition of calcium deposits in soft tissues, not only in the soft tissues, but it also in the myocardium, in the heart, and in the kidneys. And elevated levels are seen in hyperparathyroidism, hypophosphatemia, and pregnancy. So, what are the two commonly measured forms of vitamin D? We have 25-OHD3 and 1,25-OHD2D3. So, the major circulating form, your 25-OHD3, and this is the best indicator of nutritional status and intoxication. So, always remember that. And then, aside from the most commonly utilized technique, HPLC, by through competitive protein binding, we can also use radioimmunoassay or RIA. And the last fat soluble vitamin, guys, is vitamin K. It's named from the German word coagulation or due to its role in blood clotting. So K, German. They don't use letter C, they use letter K. Okay, so vitamin K coagulation, and then essential for the formation of prothrombin factor 2 and other coagulation proteins. And then it aids in converting precursor clotting proteins to functional forms in the liver. And this is the vitamin that is, we don't derive this from largely from the food or from dietary sources, but vitamin K is synthesized by the intestinal bacteria, and it provides 50% of our daily needs. And remember, if the vitamin K, no, if the intestinal bacteria are killed by antibiotic therapy, then you will also develop hypovitaminosis with vitamin K. And absorption specifically is in the terminal ileum and possibly by the or in the colon. And we can get vitamin K also if since the intestinal bacteria will only provide half of the daily needs, so we can get it the other half from cauliflower, spinach, cabbage, leafy greens, pork, liver, soybeans, and vegetable oils. However, the deficiency, guys, is rare. Really, it's rare in healthy children and adults. So, see, antibiotic therapy is one of the major reasons why we can develop vitamin K deficiency. It's not a good thing to do self medication with antibiotics because the presence of antibiotic therapy, especially if it's not in the proper drug regimen, the proper drug regimen is not followed, it reduces intestinal bacterial synthesis. And vitamin K antagonists like warfarin and coumadin prevent functional clotting factor production, increasing bleeding risk. So these are the antagonists of vitamin K. They are they are trying to inhibit or block vitamin K function. If vitamin K is for coagulation, warfarin and coumadin are for bleeding tendencies. And then deficiency can lead to hemorrhagic episodes. Next, vitamin K. In the clinical testing and diagnosis, we have PT or prothrombin time. So this is showing the clotting speed. It measures the clotting speed after the addition of thromboplastin and calcium to the sample of the patient, if it is plasma. And then the normal range is 11 to 15 seconds. And then remember that prolongation of the time, the prothrombin time, signifies deficiency in vitamin K and possibly together with liver disease. And then we also have PTT, so also prolonged in deficiency, similar to our prothrombin time or partial thromboplasmin time. We also have TT. In this one, it's quite in contrast because it remains normal. The level will remain normal even in the presence of vitamin K deficiency, the thrombin time. We also have the direct vitamin K testing, which is not commonly performed. And our PT, prothrombin time, is used as a functional indicator. The toxicity in vitamin K is not common in adults, and if it happened in an infant, so it can lead to hyperbilirubinemia, so increased bilirubin levels, the blood, and then we can observe interactions, herbal drug, vitamin to herbal interactions in the presence of garlic, ginkgo, and ginseng, and may enhance comadine effects, increasing bleeding risk. So people taking vitamin K should not, especially if the levels are high, should not. They should be very careful in taking supplements associated with garlic supplements and ginseng and ginkgo biloba. Next, there's water soluble vitamins, vitamin B1, thiamine. So, this one functions as a coenzyme in the metabolism of carbohydrates and branch chain amino acid metabolism. It's in the small intestine, it is absorbed and excreted in the urine. And then the thing you should remember, a deficiency in thiamine means that you might develop beriberi. And this is commonly observed in chronic alcohol abusers due to decreased intake and absorption. So, what's the best indicator for thiamine is the RBC or erythrocyte transketolase (ETK) activity should be more than 25% increase after thiamine pyrophosphate uh, addition, and then it means or yeah, it means a deficiency of thiamine or vitamin B1. Next is riboflavin. So we have vitamin B2. So this is a component or essential building block of coenzymes FAD and FNM involved in oxidation reduction reactions, and similar to vitamin B1, absorption is in the small intestine and excesses is excreted in the urine. So there's no known toxicity with riboflavin, and then it's found in milk, eggs, liver, and leafy vegetables. But similar to the previous vitamin, it's also affected with alcoholism, chronic diarrhea, and malabsorption. What's the best indicator is the reduced glutathione reductase activity. We also have vitamin B6 or pyridoxine. It exists as pyridoxine if derived from plants, and pyridoxal or pyridoxamine from animal products. See? And yeah, similar to the previous vitamin, deficiency is rare. And then high protein intake increases B6 requirements. And deficiency is linked to hyperchromocysteinemia. And then toxicity is rare, but if uh, there is this toxicity, it might lead to peripheral neuropathy. Similar to patients having diabetes, because these DM patients also have peripheral neuropathies. Niacin or vitamin B3, it's derived from dietary tryptophan and it exists as nicotinic acid and nicotinamide. It functions part of NAD and NADP coenzymes, and it's really needed in metabolism, glycolysis, and lipid metabolism. Absorbed in the small intestine, excreted in the urine. And if it's deficient, it leads to pellagra. And symptoms of pellagra is diarrhea, dementia, dermatitis, and death. And still seen in alcoholics. Next, folate. So this one should be supplemented to pregnant women. So functions as a coenzyme in one carbon transfer reactions, and it is closely related to the metabolism of vitamin B12, because if deficient, both can lead to megaloblastic anemia. So if decrease in B9 and B12, there is megaloblastic anemia. And then the bad thing, cooking with water destroys the folate. So better maybe we can eat green leafy vegetables raw and the fruits. But I don't know with the organ meats. And then increased requirements. See in pregnation, lactating women, patients with anemia with hemolytic origin, IDA, and prematurity, premature infants, and dialysis. Deficiency indicators. So the following will tell you an early sign of vitamin B9 deficiency is low serum folate, and then what is really noteworthy is the finding of hypersegmented neutrophils, hypersegmentation, and then there is increased for me glutamic acid or FIGLU, and then low erythrocyte folate. But the best indicator is your low erythrocyte folate, but the early sign is your low serum folate. You can also have serum homocysteine elevations. So the drugs affecting folate, we have anticonvulsants, methotrexate, sulfasalazine, and isoniazid. This is an anti-TB drug, tuberculocidal drug. And then toxicity, known toxicity, and then maybe the best, the only thing that you really have to remember with folate is this one. It should be given higher in pregnancy so that we can prevent neural tube defects in the fetus, to prevent like spina bifida. Those are the things with folate or vitamin B9. But some pediatricians and OB/GYNs will recommend that to pregnant women to eat malunggay because they said malunggay is high in folate. We also have vitamin B12 or cobalamin, so cobalt-containing compound with a corine ring structure, absorption in the ileum, and with the help of the IF or intrinsic factor coming from our stomach. So this one is a coenzyme. So always remember, and vitamins they are largely are functioning as coenzymes in various processes. This one it's a coenzyme in hematopoiesis and in the metabolism of fatty acids. And then it plays a role in DNA synthesis and neurological function. And in these animal products, you can get. However, the people who are highly affected with deficiency in vitamin B12 are those who are vegetarian people who are on a strict vegetarian diet. And then deficiency common in the elderly, strict vegetarian. So it's not also okay, no, if you are really a vegetarian, you're not having cobalamin or vitamin B12. And those with celiac disease, fish tapeworm infection, they're also prone to develop deficiencies. And it leads also to megaloblastic anemia or pernicious anemia and other neurological disorders. And in addition to pernicious anemia, this one is correlated to the intrinsic factor antibodies and parietal cell antibodies. So, vitamin B12 cobalamin diagnostic tests. So, the most common is the Schilling test. No? So, using radio-labeled B12, we also have serum B12 levels. And we have methyl malonic acid for the definitive diagnosis. The good thing with vitamin B12 or cobalamin, there's no reported toxicity. So next is biotin. So this one for transfer reactions. So it's functioning in the following metabolic processes. We have fatty acid synthesis, lipogenesis, and gluconeogenesis, and synthesized by gut bacteria. Intestinal bacteria, vitamin K. This one synthesized by gut bacteria. We have biotin. So, deficiency caused by raw egg white ingestion. So, because the evidence present in the egg white will bind to biotin, and seen in long-term parenteral nutrition and enzyme defects. So next is vitamin B5 or pantothenic acid. So we can see this in all animal and plant tissues. It's converted to coenzyme A. Actually, this one is in Nivea, the lotion, coenzyme A. So that's vitamin B5, and it's essential or needed for acyl group transfer reactions. Then deficiency is rare, but indicated by low blood pantothenate and low urinary excretion. So low test measuring acylated para-aminobenzoic acid. So that's this load test. This is one of the assays used for vitamin B5. Next is the most common vitamin C, ascorbic acid. This one is a strong reducing agent and it's needed or important for collagen formation. So, if you want to prevent wrinkles, aside from taking collagen supplements, since vitamin C is needed for collagen formation, don't just take collagen. Also, you must have proper vitamin C intake. And then iron absorption and catecholamine synthesis. It's found in fruits and veggies. And scurvy. You can your body will tell you if you're deficient with vitamin C already because you can observe that your gums are bleeding and your wound healing is impaired and you tend to develop anemia. However, excess intake interferes with vitamin B12 metabolism and other drug interactions. And lastly, we have carnitine. This one is a conditionally essential nutrient involved in fatty acid metabolism, found in the following, and it's not present. It leads to muscle weakness and fatigue. So, what are the causes of depressed or low levels? Could be hereditary. This is the only vitamin that can also be have inherited causes or acquired through pregnancy, valproic acid therapy, and dialysis. We can also have strict vegetarian diet because this a strict vegetarian diet only gives 10% of human needs and then synthesized in the liver, brain, and kidney. So somehow the synthesis is weird because it can also be produced in in the brain and in the kidneys. And we have for the manner of laboratory diagnosis, total and free carnitine levels are measured. That's the end, and thank you.